2 years ago, a 29-year-old Ottawa man was living a carefree life until he received a grim diagnosis. Luke Rochefort was told he had testicular cancer, and just like that, life as he knew it would forever be changed. And that devastating diagnosis was only just the beginning. I sat down with Luke to chat about his cancer journey and the clinical trial that may have saved his life.
So 2 years ago, something funny was going on with my body, and I ignored it for quite some time, like most males do. And basically, one of my testicles became quite swollen. And I ignored it, and just hoped it wasn't the C word. Eventually, pain set in and I couldn't ignore it any longer. I was diagnosed with testicular cancer. So within days, I basically had the testicle removed, and then a whirlwind started. First started with chemotherapy, 4 rounds, where basically I would be in the hospital for a week, out for 2, back in for a week, knock you back down. But all things started to get back on the right track, and then a few months later, everything snowballed again. I actually had a seizure, and where I was taken out of my workplace in the middle of the dinner rush. I had 5 surgeries. 3 were to remove the tumors, and 2 were due to remove infection that had set in from the surgeries.
Where were the tumors?
In my brain.
Wow.
So
what started as testicular cancer
spread to my, in the process, spread to my abdomen, my lungs, and then my brain.
Wow.
So I did 15 rounds of radiation, and then we were running out of options and kind of scrambling. What are we going to do? I tried chemotherapy for a bit again, and then CyberKnife came up. And basically, CyberKnife was explained to me as something very new in clinical trial phase, and the success they were seeing with it was positive. Mm-hmm. So they asked us, myself, would I be interested in being a clinical trial? And I said yes, for sure, at this point, anything. So I was within the first 250 people at the Ottawa General Hospital that used it.
How important is it that you were on that clinical trial and that you had the use of the CyberKnife in your treatment? Would you be here today without it?
CyberKnife was the game changer for me.
Wow.
Yeah.
So when it comes to funding clinical trials, it's crucial.
Yeah, it is very crucial. There's 3 in Canada, and we need more.
Tell me a little bit about where you are today. How are you feeling?
I'm, knock on wood, but I feel great. People ask me today if I was to do something different, or what I can give for advice. Listen to your body. Don't ignore it. Listen to what it's telling you. And when you see an abnormality, if you wait too long, it could get worse. If you get it early, you can have success with it. Mm-hmm. So my biggest thing is listen to your body.
Now, since 2008, the Ottawa Regional Cancer Foundation has allocated more than $1.8 million to cancer clinical trials. Those include radiation oncology, breast cancer trials, fellowships in brachytherapy, and the CyberKnife trial. I spoke with Dr. Glenn Goss about how far they've come.
The path to successful drug development and technology development is much shorter now than it was 10 years ago. It used to take on average about 15 years to get a drug into standard practice. Now it's in the order of 5 to 6 years, and in some cases, just recently, a drug has gone from its earliest development to to registration as a standard therapy in under 3 years.
Wow.